We're practicing our overdose response so we can stay sharp and ready, and you can too. Why do drills? Even if you had naloxone training, it's important to refresh your skills on a regular basis through practice. Just like earthquake and fire drills, regularly practicing what you would do if faced with someone overdosing is vital to maintain your preparedness. It's important to note that the overdose drill does not replace naloxone training. These drills are meant for people who have attended the training and are looking to practice to keep things in the foreground. If you'd like more information on where you can get naloxone training, go to www.towardtheheart.com or www.fraserhealth/overdose drill. So let's get started. I'm going to turn it over to Erin, one of our regional harm reduction coordinators, and she's going to go over all the equipment and materials you need to practice your overdose response.
Thanks, Marika. So you want to first locate your naloxone kit that you would have on your site, and you want to double check the contents of your first aid kit, and you want to put in, just for the purpose of this drill, some practice supplies, so some practice ampules and amp breakers, and some vantage point syringes. You could grab an orange or a stress ball, a demi-dose injection pad, or you can take a little jar and put some sponges or some cloths in it just for practicing or simulating injecting into a thigh. You also probably want to have a sharps container handy and nearby. It's important before you drill to develop your overdose scenario, determine where the drill will occur. It's best if it's like somewhere where an overdose might likely occur, like near a bathroom. Decide how you will raise the alarm and what it will sound like. Designate different people on your team to play different roles, and who will play someone who is having an overdose. Plan how you will proactively let others who work around you or who may be in the same space know that there will be an overdose drill at this time. Post notices for visitors and staff where the drill will take place so that they are not alarmed. All this information is in the drill toolkit at www.fraserhealth.ca/overdose drill. It's important that the purpose of this drill is not to be perfect, but to work out any problems that may happen, and so that everyone feels prepared and ready to go. Let's start the drill. Ken, I don't think he's breathing. Ken, I'm going to nudge you with my foot. Ken, take a breath. 10. I'm going to stimulate. He's not responsive. Scott, call 911.
Of course.
Andy, help me move him to the floor. Erica, go grab the naloxone kit from under the cupboard. Okay, thank you.
Hi, is that 911? Hi, yes, we've got a person who's unresponsive and they're not breathing. We think it's an overdose. Our address is 1234 98A Street, Surrey. So he's a male in his 30s. He's got blue lips and blue fingernails, and he's making some gurgling sounds. Yeah, we've got 2 people who are responding. They're going to give breaths and naloxone. Yeah, I'll stay on the line. Anthony, can you go and meet the ambulance and direct them, please? Great. Could you just make sure that nobody gets into the room, please?
Hey, Erin. Hi, Erica. He's not breathing. He's not responsive. His name is Ken.
His name is Ken?
Yeah.
Hi, Ken. This is Erica.
I'm going to get out my pocket mask and check his airway. Make sure there's nothing obstructing his airway. Tilt his head back. Ken, take a breath. He's not breathing. He's not breathing.
I'm going to put on my gloves.
Okay, I'm putting in the mask. I'm going to pinch his nose and give 2 big breaths.
While Erin's giving breaths every 5 to 7 seconds, I'm going to get the naloxone ready to administer if he doesn't respond. Inside are your ampules of naloxone. Always look for the silver button This is where you want to put the pressure on. It's your sweet spot for snapping. Also, before you snap, please make sure that you swirl the naloxone, making sure that all the medicine is in here and not in the neck. All right.
Ken, take a breath, Ken. Stay with us.
Sorry.
It's okay, Erica. I'm breathing for him.
I went. Keep breathing for him. Come on, Ken.
Here.
Okay. We're going to put the vanishing point syringe into the ampule. Make sure you get all of the medicine into the syringe. Okay. There's a little bit of air in there. We're gonna push that out. It's okay, it's a muscular injection, but we don't want a whole lot in there. There we go, about like that. We're also going to make sure that we give the injection into a large muscle. It's a muscular injection, so the thigh, the arm, or in the backward hip. We're gonna use the thigh. Make sure that you put the syringe in straight so it makes a 90-degree angle into the large muscle. And we're going to push, and you can hear that snap. And as you can see, the needle has been retracted into the syringe, so it's safe to lay down just in case you were to roll on it or put your hand on it. How's he doing, Aaron?
I don't know. Ken, take a breath. You've overdosed. Andy, help me move him into the recovery position.
It looks like Ken is coming to, and his respiratory system is back working, so I don't have to give him a second injection. If he wasn't to come to, be waiting 3 to 5 minutes, and I would administer a second.
Ken, you had an overdose. Help is on the way. We've rolled you into the recovery position to clear your airway. Tilt your head up in case you vomit. Okay? Erica, can you stay with him?
Yes, I certainly can. Hey, Ken, this is Erica. I'm just gonna put my hand on you right here. I'm gonna stay with you, okay? Help's on its way. I'm right here.
This concludes our overdose drill. That's the end of the drill. After your team does the drill, it's important to debrief right after. Talk how everybody is doing and feeling, and discuss what worked well and what needs improvement. Again, the purpose of the drill is not to be perfect, to figure out the kinks. Make sure that your phone systems work, those kinds of things, that your naloxone is ready to go. Make sure you fill out the feedback form, which is included in the toolkit at fraserhealth.ca/overdose drill, to help your team go through the debrief process and identify and arrange support for additional overdose response. There are a few things that are important to note. Before doing an overdose drill, or before responding to an overdose, you want to do an overdose or an environmental scan to make sure you're safe, that there's nothing that you're going to kneel on and hurt yourself. It's really important. People who overdose, sometimes can be very painful to come out of an overdose. So they may not remember what have happened leading up to the overdose. So it's important, and they might be scared. So it's really important that as they regain consciousness, you let them know what's happened and that they're safe. It's really important to give breaths. Even without naloxone, this can help prevent brain damage and help keep people alive until first responders get there. If someone has overdosed in a car, on a couch, or in a bed, make sure you put them on the floor on a hard surface before beginning giving breaths or administering naloxone. You saw that we moved Ken from a sitting position to a laying down flat position, which helps to open his airway. And in the event that 911 instructs you to give chest compressions, that you're ready to do that. In the toolkit at fraserhealth.ca, there is a one-pager sheet on tips on administering naloxone. This, the importance of swirling to get all the medication into the bottom of the ampule so that you're giving a full dose of naloxone. Ensuring that you see that the 1-point cut, the OPC dot, as Erica mentioned, is right here. So that is the sweet spot, and it's just cut under there. If you try to open the naloxone from this side, it won't happen, but from this side, it will snap very easily. It's important to call 911 and keep them on the phone at all times and listen to their instructions. You want to check your building protocol on how to respond to an overdose. And also, doing the drill is a really good time to check your naloxone expiry, and also to reinforce that naloxone should not be kept in your vehicle, as it is heat and light sensitive. This is especially important during the summer months when it gets really hot. If you use substances, please try not to use alone, and consider using the supervised consumption services or an overdose prevention site. And it's important to have a plan and a kit for yourself and others that you may be with, ensuring that they know how to use naloxone and that they feel comfortable calling 911. If you are a person who cares about someone who uses drugs, please consider how you offer support. We have more resources on fraserhealth.ca. I'm going to hand it over to Marika now for some final messages.
Great. Thank you, Erin, and thank you, everyone. Again, overdose drills do not replace naloxone training. They're for people who have already done the training and want to practice to keep their skills in the foreground. Go to fraserhealth.ca/overdose drill for more information about naloxone training, these drills, and how to coordinate your own drill at your own site.